Hello, my name's Jolyon Ford. I'm an obstetrician gynecologist and I'm talking to you today about coronavirus. The first thing that people are wondering is, are pregnant women particularly at risk with this? We don't think there is any evidence that pregnant women are more likely to catch coronavirus. There are, however, some good reasons why it may be appropriate for pregnant women to avoid the chances of them getting it. We know from our experience of looking after women with influenza is that they can sometimes be more prone to getting bad infections if they catch influenza in pregnancy, and that's why we encourage and still are encouraging women to get vaccinated for influenza in their pregnancy. Having said that, there aren't any significant reports of coronavirus causing pregnant women to become extremely unwell. There are a few, but really very limited information at the moment. The other advice at the moment is that, at least from our limited understanding of how coronavirus affects pregnancy, we don't think that there is a high chance of it causing miscarriage or stillbirth. There's been one case of preterm birth reported, but it's unclear whether the preterm labour in that setting was anything to do with the coronavirus. There is also no evidence that the coronavirus passes on to the baby whilst the baby's still inside you. There have been some studies where they've actually taken some amniotic fluid through a process of amniocentesis from around the baby, and that has not been found to be positive for coronavirus, and babies that have just been born who are tested don't seem to be positive as well. So there doesn't appear to be any direct impact on the baby. There's certainly no malformations that have been described from coronavirus infection in pregnancy as well. Having said all of that, as I mentioned, we do want to reduce the risk of women getting severe fevers. They certainly are worth avoiding in the first part of pregnancy, and we'll be talking to you about some ways that you can reduce fever if you do have an infection in the early part of pregnancy. Standard precautions that have been recommended worldwide. Good hand hygiene. We know that that coronavirus is transmitted through droplets from sneezing and coughing that can end up on your hands. And then if you touch your face, touch your eyes, your mouth, or your nose, then you can pass that infection on to yourself. So good hand hygiene is extremely important, and you'll all be aware of the importance of washing your hands thoroughly for at least 20 seconds. Avoid touching your eyes, nose and mouth. Cover your nose and mouth when you are coughing or sneezing, using the inside of your elbow or the upper arm to protect yourself if you are coughing, or protect others when you're coughing and sneezing. If you need to use a tissue, use a disposable one, dispose of it straight away. Avoid shaking hands with people, direct hand-to-hand contact. And the other general advice is currently that people, pregnant women in particular, should avoid non-essential travel and limit contact with others. That doesn't mean you necessarily have to stay completely isolated, but keep that contact with other people down as much as you can. In particular, avoid contact with those who may be at high risk, those who've recently travelled to an endemic area, or those who are unwell themselves. So if you're well and you've had no recent contact that you know of with coronavirus, what should you do? Well, check with your provider that their processes have not changed. Sometimes clinics are having to reschedule appointments. A lot of my colleagues are having to space out the appointments so that women are less likely to be sitting with each other in a waiting room, for example. So you may find that your appointments for clinics or for your investigations, such as your ultrasound, may be changed. So do check that your appointments haven't changed. Do continue to have your normal care and investigations through your pregnancy. When you do come to those appointments, take precautions that are appropriate to your region, and I'll give you some links on this page for social distancing. Minimise the number of people who come to the clinic with you. We want to keep clinics as quiet as possible and to have as much space between people who are sitting in an antenatal clinic as possible. Do wash your hands before and after. Use hand sanitizers if you're unable to get access to hot soapy water, but the preference is warm water and soap for 20 seconds at least. Hand sanitizer, which is the alcoholic sanitizer, if that's not available. So if you have symptoms or possible contact. So if symptoms include a fever, of course, is one of the key symptoms, a cough, or any cold-like symptoms, then do stay at home. Avoid contact with other people. Don't go straight off to your antenatal clinic appointment if you've got a streaming cold or you're coughing or sneezing. Do follow your local testing guidelines. They are different in every country. Some of countries, as you may be aware, are testing more liberally. Others are testing only under certain circumstances. So do check with your provider, your family physician, your general practitioner, whether you need to have a test. If you have a fever, then it's safe for you to take regular paracetamol in pregnancy, which is Tylenol in the US, paracetamol or Panadol, and take that regularly until the fever settles. Keep yourself cool. If your temperature is very high, then cool yourself down with a tepid shower, a face washer with some cool water on it. Do contact your provider about your appointments. Make sure you tell them that you've got symptoms. Make sure if you've had contact, make sure you tell them as well. And they may wish to make special arrangements for you to come to a particular area where you can be seen with more careful precautions to make sure that you're not causing infection to be passed to anybody else. Do call if you have any urgent symptoms. So just in the same way as you would do if you have reduced movements of the baby, if your membranes are ruptured, your water's broken, just call and in the normal way call for advice. But at the same time, when you're talking to them about any pregnancy symptoms, tell them that you've got cold or flu-like symptoms. Tell them if you've had a fever. Again, so that special arrangements can be made if you do need to come in and see your health professionals. If you have severe symptoms, if let's say you have significant shortness of breath, then that is an appropriate time for you to seek urgent medical attention. It would be appropriate then to call emergency services. Again, let them know what your symptoms are, let them know if you've had any recent contacts so that they can manage the situation appropriately. If you have a pregnancy emergency, such as heavy bleeding or you're suddenly going into very rapid labour, again, call emergency services as you would normally do so. Call your maternity provider, but do tell them about your other symptoms as well. If you need to attend an emergency department because you've got shortness of breath, if you've got signs of a pneumonia, then you will very likely be advised to have some kind of imaging of your chest, because that is the best way of diagnosing a pneumonia. So if that's the case, you may be concerned about the possibility of having a chest x-ray or a CT scan of your chest, which are perhaps the two commonest ways of investigating this. In this situation, if you've got a bad chest, if you're having trouble with breathing, you should have those investigations, because they can really help to make a diagnosis and give you appropriate treatment. The risk to a baby from a single chest x-ray or from a CT scan is very, very small, and in the setting where the mother is significantly ill, the priority is to make sure that the mother has an accurate diagnosis and is treated appropriately. So if you're unwell and have perhaps a suspected case of coronavirus and you go into labour, again, call before you arrive. Monitoring of the baby is recommended by one of the guidelines, which is the British guideline. There have been some cases in China that were reported where there was a higher level of abnormal heart trace patterns in women in labour with coronavirus. This is only if you're really feeling sick. If you're feeling fine, then continuous monitoring would be according to what your local protocols are. You can still aim for your normal plans for labour and birth. You should still be able to mobilise. You should still be able to have all the other pain relief options that are available in your local service. If you're symptomatic, staff will have personal protective equipment on, which involves gowns, as I mentioned, gowns, gloves, visors, and of course face masks. Your birthing support person is of course still welcome to come and join you, but if they've been with you and living with you for a period of time, then they may be advised to wear a mask. They may be advised to wash their hands regularly to make sure that they limit the chances of them passing on an infection that they may not know they've got yet. If your birthing support person is symptomatic, if it seems that they are a suspected case of coronavirus, they should not come to the hospital with you. They should stay at home, and if there's a possibility of another person who's well coming to be a support person for you, that is something that you should explore. So if you have a suspected case of coronavirus and you have a planned birth coming up, so that might be an elective cesarean section, it might be a planned induction. Again, speak to your provider, because if it's safe to do so, it may be appropriate to actually delay that appointment, that scheduled procedure, for a period of time until you're actually more recovered. Firstly, to make sure you're as well as possible when you go through that birth process, but also to make sure that you limit the likelihood of passing on that infection to other people, other healthcare professionals around you. Again, speak to your provider for advice rather than just turning up on the day. After the baby's born, then it's reasonable just to aim for normal care of the baby. And there is no suggestion at the moment that babies need to be routinely tested if the mother's been affected. If you are symptomatic, you may be advised to be discharged home early to have home care, again to limit the likelihood of you passing on infection to any of the health professionals in the hospital. Breastfeeding is still supported. There are benefits of breastfeeding. If you have been recently unwell, then your body will be making antibodies, and they can be passed on to the baby to support the baby's immune system. There is no evidence at the moment that coronavirus can be passed on in the breast milk. I know that some countries in the last few months have been separating mothers and babies, but the general feeling is that as long as you're well enough to be able to look after the baby, it's still appropriate that you are together. What is advised though is if you've got a bad cough, for example, if you're symptomatic, that you actually wear a mask whilst you have close contact with the baby. So whilst you're breastfeeding, wear a mask. Practice good hand hygiene both before and after breastfeeding to minimise any chance of virus being passed on or in contact with the baby. As I mentioned, I'll put a number of links through. Have a look at what your local guidelines are. Have a look at if there's a relevant link to your country that I'll put in there from certainly the English-speaking countries, as many as I can find. But do also ask your local providers what their protocols are and whether there needs to be any change in your care. This is a stressful and difficult time for everybody. We know that it's natural and normal to be apprehensive, but try not to panic. This is not something that is causing massive problems in the pregnant community. Your care professionals will be aiming to provide you the best quality of care and to provide you with physical and emotional support through the whole thing. So look after yourselves, make sure you practice your hand hygiene, try to keep away from the general public if at all possible. Avoid those who may be symptomatic and try to maintain a positive outlook if you can. Good luck. Thank you.